Hi, Dr. Corinne Knight here, and I've been going to the running store and giving some question clinics every other Thursday night. And we had quite a successful first clinic. We had a couple questions, and I just wanted to address them with 3 videos. So our first video, we had a question about hip flexor pain. A runner came in, and she's been training for the half marathon, and she said that after a while, about a mile of running, she had some hip flexor pain. So I'm just going to talk to you guys about 3 ways that you can fix that. Jim here, who is a runner, is going to go ahead and show us some of these stretches. The first one is called a hip flexor or psoas stretch. And what you're going to do is you just take a chair, you're going to put the leg that you don't want to stretch first up, and so he's going to put his right leg up first, and your access point where you should be stretching, I'm going to move your arm here, is right here along that hip flexor. He's going to lean forward, and sometimes if you keep it right there, you're already going to feel a stretch. Do you feel a stretch already right there? Yeah, you don't need to go very far. If you want a little bit more of a stretch, you take the same arm as the leg you're stretching, bring it up over yourself, and you feel a lovely stretch there. I usually recommend people to hold it for 30 seconds and do it 3 times. But for sake of a short video, we're just going to show you how it's done. Next stretch, because you want to make sure that that hip capsule, that entire hip complex is open, you're going to do what's called a piriformis stretch. So Jim's going to go ahead and sit down, and he's going to cross his left leg over his right. And do you already feel that stretch right there? And where do you feel that stretch, Jim? Right up in there. So once again, we're opening up that hip capsule. If you're really flexible, you can lean forward as far as you want. I think this is pretty good for Jim right here. Once again, 30-second holds 3 times. Excellent. And you can go ahead and keep stretching there if you want, Jim. And while he's doing that, I'm going to talk to you also about ibuprofen. Personally, I think that ibuprofen as an anti-inflammatory is a good thing. If your doctor says otherwise, or if it causes gastrointestinal issues, go ahead and avoid it. But because it is a systemic anti-inflammatory, it's really good to go ahead and give that a try if you're getting any type of inflammation in your hip. Of course, try and comply with the recommended dosage, but stay on top of the pain, making sure that you stay within that 4 to 6 hours is recommended. Okay, good luck with your hip flexors.